Good evening, and welcome to our Zoom room as we present part 2 of the Siena Shares Series event, The Versatility and Value of a Master's Degree in Healthcare Leadership. Our presenter tonight is Siena Heights University Professor and Director of the Graduate Program in Healthcare Leadership, Dr. John Fick. John has more than 40 years of work experience in the healthcare industry, including leadership, administration, strategic planning, business development, and higher education. For over 20 years, he has also maintained a private healthcare consulting practice specializing in leadership development, strategic planning, business development, and regulatory affairs. He earned a Doctor of Education degree from Argosy University and a Master of Science degree from the Wayne State University School of Medicine, where he majored in community health services. His undergraduate degree is from Madonna University. John is also board certified in healthcare management and a fellow of the American College of Healthcare Executives. Please save your questions for the end of the presentation in our Q&A area, and also feel free to use and follow our chat function during the presentation. At this time, I would like to introduce our presenter, Dr. John Fick.
Thank you very much for that kind introduction. I want to thank you and your staff, the marketing and communications staff, for helping us communicate Siena Shares relative to healthcare management and healthcare leadership yesterday and today. So thank you so much for that. Also joining us tonight is John Labriola, who is a professor in the healthcare management program in the College of Professional Studies, as well as Betsy Brooks, who is our academic advisor and does in fact touch each one of you at some point in time as you look to enroll in the graduate program in healthcare leadership. I'm glad to be here tonight and talk to you about, as Doug mentioned, part 2, talking about the value and the versatility of a degree in healthcare management and healthcare leadership. And specifically tonight, we're going to talk about the master's degree in healthcare leadership offered by Siena Heights University. Before we begin, I think it's only fitting, here's some names again and email addresses, only fitting to reiterate what Mr. Labriola mentioned last night, and that was to thank all of our healthcare workers, those of you that have been on the front lines in hospitals and other healthcare settings for months now, working unceasingly to deliver the best care and the best service to patients and consumers in your various areas. So we really do thank you. You truly are the heroes, and we thank you so much for all that you've done and all that you've sacrificed over the last number of months. As we begin this evening, I thought I'd provide just a little bit of background relative to Siena Heights University. Some of you are very keenly aware of Siena Heights University, and some of you may not be as aware of Siena Heights University. So let me just give you some broad brush historical perspective of the university. It was founded by the Adrian Dominican Sisters back in 1919. So last year we actually celebrated our 100th year as a college and as a university. And that was just a fun year to celebrate all that's happened over those 100 years with Siena and the growth that's taken place with Siena. We are accredited by the Higher Learning Commission of the North Central Association. So we are accredited by, most people say, HLC. Our main campus, if you look at the map on the left side of the screen, you'll see Adrian in sort of the center bottom portion. That's where the main campus is located. That's where all of our support staff, our deans are based, as well as our residential campus, the College of Arts and Sciences. In addition to our main campus, we have 8 satellite locations across the state of Michigan, and you can see that they're all, for the most part, in the lower half of the state of Michigan, and the pins will identify where those various satellite locations are. And then lastly, and more widespread, no doubt, is the totally online campus, if you will, that we have, where we have students coming from really all over the country, in fact, all over the world at different times. So again, we have a wide presence, not only throughout the state of Michigan, but throughout the United States and the world. Related to that, I wanted to give you some perspective on the Healthcare Leadership Program and just give you a broad brush overview of that as well. The Healthcare Leadership Program initially started as a healthcare administration program back in 1998, and it was based in one of those satellite locations, Southfield, Michigan, in the southeastern Michigan part of the state. It was a Master of Arts degree in healthcare administration. Today is a Master of Arts degree in leadership, healthcare. Back then and even today, it continues as 12 classes or 36 semester hours for students that take our courses. And the classes today, unlike back in 1998 and the early 2000s, are now offered totally online, or TOL, and what we call 7-week subsessions throughout the year. And I'll talk a little bit more about that in just a bit. By design, our healthcare leadership program is for working adult professionals. So the vast majority of our students are involved and employed by healthcare settings. They are oftentimes nurses or rad techs or respiratory therapists, massage therapists. We've had a variety of, again, healthcare professionals that come to us with that kind of work experience. As I mentioned, the design now of the Healthcare Leadership Program is totally online courses and with residency requirements. So you don't have to come to campus we don't need to congregate at any point in time during your years of matriculation at Siena Heights University. Everything is done virtually and is done by way of a Canvas learning management system. We have 6 7-week subsessions throughout the year. There are 2 in the fall term, and our term will start August the 31st and then run through December. 2 in the winter time, and then 2 in the spring, summer. So again, 6 subsessions of 7 weeks each. I will say what makes our program particularly unique by design is the strong application that we have for the practitioners. As I mentioned earlier, the working adult professionals are largely clinicians by background. And with that said, they are fairly comfortable with the healthcare setting, but need to develop their management skills, need to develop their leadership potential, and that's the focus of our program, again, by design. The competency model that we tend to use in our healthcare leadership program is the competency model put forth by the American College of Healthcare Executives. And as part of that, there are 10 knowledge areas that they examine for board certification. And so we touch on each one of those knowledge areas in various courses during the program. As I mentioned, the healthcare leadership is designed for both early careerists and mid-careerists. So we're looking at folks that have absolutely no management experience, but served all of their time, if you will, in a clinical role. We also have mid-careers. We have those that work in supervision, early management positions. We've even had a few upper management folks in our program that have come back to earn their master's degree in many parts for the purpose of pursuing the board certification in healthcare management, because one of the eligibility criteria is that you have a graduate degree from an accredited college or university. This is just a nice graphic that we have in some of our collateral pieces, but again, it portrays to you the working adult and just the key words that you see here, the fact that we're affordable, and Betsy can certainly answer questions about that towards the end. We're extremely flexible in terms of scheduling. Our students start essentially anytime they want, although I will say the vast majority of our students start in either the fall 1 or the winter 1 terms, although we have students that sprinkle in throughout the year. And again, because of the online nature of our program, it's extremely flexible. So you're not required to be in a classroom every Tuesday night from 6 until 9 p.m. Instead, after you are home and have an opportunity to unwind a little bit and get online, then you have an opportunity to then get involved in discussion questions or start working on projects that you might be involved in our program. I will say too that another unique aspect of our program is the fact that we are a recognized program of the Higher Education Network of the American College of Healthcare Executives. It's called the HEN program of ACHE. So we have been a member of the Higher Education Network at ACHE since December of 1999. And we have had initially student chapters. They've since disbanded student chapters and become part of local chapters. But our students, despite that, pre-COVID, at least have attended various professional educational sessions and networking sessions with senior level executives from a variety of healthcare systems, hospitals, and so forth, through the Midwest chapter of ACHE, or if you're from an area outside of the Southeastern Michigan area, we will put you in touch with a local chapter in your particular jurisdiction. One of the things that our program does do and participates with as part of the Higher Education Network of ACHE is two main things. One, every fall, our student team will represent the university in the university program as part of the case competition. And so we go up against 4 other graduate programs in health administration in the region. And I'm proud to say that we have won that competition twice and gone and are looking to win that again the next time around. The other piece that our students really appreciate being involved in is a benefit called Job Shadow Day. And so, again, these are not requirements, but they're opportunities for you to grow and develop as professionals. But we will pair you with a healthcare executive in a local hospital or healthcare setting so that you can follow him or her around for the day, get an idea of what it's like in the typical day of a hospital executive. And the feedback that we've received from students as well as executives over the many years that we've been doing this has just been phenomenal. Students really appreciate that opportunity. So consequently, if you will, the membership as a student associate in ACHE is a program expectation. And we do ask students to join ACHE and have built that into the program through various learning assessments and requirements for networking and educational pieces. Also, every year, typically in March, the American College of Healthcare Executives offers their annual Congress on Healthcare Leadership. That was canceled last March of 2019. We expect, though, that may happen again. We're uncertain at this point in time, but we have small to large contingents of students that travel to Chicago with us and participate in that event. There's about 4,000 healthcare executives from around the globe, really, mostly the United States, but around the globe, that attend for networking, for professional development, educational sessions, and there's even opportunities to get some career advice from the Career Center in Chicago when you attend. And we do offer scholarship dollars for students that are attending each year. So this is the curriculum for the Healthcare Leadership Program. As I mentioned earlier on, it is a 36 semester hour program. We have 5 common core required courses that you see on the top half. A leadership theory course, a research and professional writing course, an organizational culture and communication course, a finance and quantitative leadership course, and a strategic course. So those courses are shared with other students in the leadership program as a whole. So they could be students from our organizational leadership program, they could be students from our higher education program, and of course there will be students in there from the healthcare leadership program. So those are the common core leadership required courses. The bottom half of the description here outlines the courses that are specific to you, those of you that are interested in the healthcare leadership program. And I'll just run through each one and try and give you a quick summary overview of what each one of these courses is like. Again, remember, these are all offered in a 7-week, totally online format. So the Leadership 609 course, the Healthcare Systems Management course, is largely a case-based course, but the culminating project in that particular course is that students develop a business plan, a fairly comprehensive business plan that they put together for ideally a real service in their hospital or healthcare setting. LDR 614 is looking at contemporary issues in healthcare administration. And here we focus on what the American Hospital Association and the Society for Healthcare Strategy and Market Development looks at relative to future issues or contemporary issues in healthcare administration. So we use a book called Future Scan to examine each of those. And the culminating project in that particular course is a debate that students enter into over the 7 weeks to talk about the pros and cons of the Affordable Care Act. Should it be repealed? Should it be not repealed? So on and so forth. And that's done through a team-based approach. Information Systems Management course is pretty self-explanatory, but it dives into a lot of the specifics relative to information systems management in healthcare. So you all obviously are aware of the electronic health record, so it will dive deeper into that and has some projects built into that course. LDR 625, the Human Resource Management course in healthcare, again is attempting to give emerging leaders a nice overview of HR and some of the relative laws related to that. Again, primarily through experiential exercises, trying to integrate theory into practice. LDR 629 is our overview of the U.S. healthcare system course. It's essentially a survey course, but what we do ask you to do in that course is to self-assess yourself on the 10 knowledge areas that I mentioned earlier that are put forth by the American College of Healthcare Executives. And you will self-assess yourself in terms of where you think you fall, and what plans you might have relative to improving as a manager and as a leader. Medical law, again, fairly self-explanatory. We'll dive into many of the unique healthcare laws relative to the industry. And then the last course is the LDR 678. This is a practicum course or fieldwork course where you actually integrate theory into practice at your places of employment. So I've got a slide dedicated to this. I like students to know this up front. So it's not, again, just about learning theory, but it's about integrating theory into practice. And so what most students do is they will work with their supervisor, their leader, their C-suite leader at their places of employment, identify a special management or leadership project that they can complete while they are actually in the program. And the site supervisor on site will actually provide some oversight, and we enter into discussions throughout prior to the course as well as during the course and sometimes after the course. But again, to give them an opportunity to showcase themselves as a student in terms of a special project at their place of employment. And believe it or not, many students have in fact been showcased and showcased very well, and as a result have been promoted. Maybe not right away, but shortly after they're done with their graduate degree in healthcare leadership. So just to back up a little bit and talk about the course sequencing for our program, we recommend one 3-credit-hour course each 7-week subsession. And again, if you take one every 7 weeks, that's 6 credit hours per semester, or 2 per subsession, or excuse me, 2 in 2 subsessions. That then qualifies you for financial aid, and Bessie can certainly speak to that. If you take one 3-credit-hour course for 12 consecutive terms or subsessions, you will have completed your program in healthcare leadership, and that would be about 2 years. So again, we will entertain admission into the program at any point in time, although the vast majority of our folks come in at the beginning of fall or the beginning of winter. This is a screenshot that I took off of the bls.gov website. And it just gives you some idea of what the career opportunities are for healthcare managers and healthcare leaders. Here, this is 2019 data, and I'm sorry for the size of this, but you can see that the median pay for a medical and health service manager was almost $101,000 per year, or almost $49 per hour. That's based upon a bachelor's degree as the entry point of education. And again, what we're looking at here is a graduate degree. So with that said, the likelihood of that being higher than the 100,000 average is pretty typical. And you can see what the job forecast listed here is as well, the job outlook, so on and so forth. So, but that's a great link to go to just to dig deeper into that. So why Siena? We are ranked nationally. You can see in this slide, we're ranked 28th by study.com. We're an accelerated program. Again, you take one course every 7 weeks. You graduate in 2 years, as I mentioned. I'll cover this on the next slide, but there is no GRE, there's no GMAT required. And so let me talk a little bit about that, and then see if Betsy wants to add anything in addition to what I've got here. So these are the general admission requirements for the graduate program in healthcare leadership. We need a completed online application, a copy of your current resume. We have an application essay. We need a copy of all of your post-secondary transcripts, so everything after high school. There is a conviction disclosure form that we ask all students to complete. Our minimum GPA is a 3.0 from an accredited institution of higher education at a bachelor's degree level. With that said, we will, on a case-by-case basis, as a leadership team, look at each admission that might fall under that GPA of 3.0. And ideally, we're looking for students, again, working adult professionals that have 5 years of healthcare experience. We have admitted students fresh out of undergraduate school, one that actually went on to work at Beaumont Health and is doing very well there. But again, it's a little bit more difficult because of the application of theory into practice if you don't have that healthcare background to help you make that application. And then lastly, as I mentioned earlier, no GRE or GMAT is required. I think that is the end of my slides. So let me just, yeah, that is. So this is my contact information. This is my cell phone number. This is my email address, and Betsy Brooks, who's also on the line, has her phone number and her email address listed here as well. So I want to thank you for signing in tonight, or maybe you'll be listening on YouTube at a later date and time. Thank you for listening. And again, please feel free to direct any questions that you might have to either myself or Betsy. And with that, I'm going to turn it over to Betsy to see if she has anything to add, things that I might have missed or things that I need to be corrected on.
Nothing you need to be corrected on. I just wanted to emphasize that the majority of our students do find that one course every 7 weeks leads to the best balance of work, family, whatever responsibilities they have. And about 99% of our students follow that format and complete their degree in about 24 months. However, if you have, maybe you've got a promotion down the line that you need that degree for, so you need to maybe go at a little more expedited rate, or maybe something happens and maybe you need to take a term off. John talked about the flexible degree plan, and that's what I will help you with, is to help you. My job as an advisor is to help you get through your program while being a busy working adult. What I always tell my students is, please call me, anything I can help with. That's what I think makes us special at Siena, is your advisor is going through it with you at the same time. So I just really wanted to emphasize that. We also do not have an application fee. So you can apply through the whole thing, and the application process, John laid it out. It's very, very simple. It's official transcripts and 3 documents. So, and again, once you tell us you're interested, that's when I start working with you right away and help you through the application process as well. And that's all I have to say right now.
Okay, thank you, Betsy. I'm not seeing any questions out here from our audience tonight. So John, I'm just going to step in and start things rolling here. You know, obviously you've been in healthcare leadership, as I introduced you, more than 40 years. What has changed the most over the time in healthcare leadership, would you say? And how has the program adapted to that?
Yeah, I guess, you know, healthcare is an ever-changing industry. I mean, when I first started in healthcare, I worked for one hospital, and now that one hospital has been subsumed into a mega corporation. I worked for Oakwood Hospital in Dearborn as my very first hospital, and that is now part of the larger Beaumont Health, which will maybe be something even larger in the not too distant future. So the mergers and the consolidations are certainly something that is sort of top of mind these days with healthcare leadership. So I would say what our program does to prepare you, if you look at some of the courses that I identified, organizational culture is understanding organizational culture at one hospital and how that may be different and how you would work to mesh that. You know, if you were, say, becoming a regional director over particularly a particular clinical service line. Strategy, of course, is an important competency to have for all healthcare leaders. You need to understand strategy, not just the implementation side, but starting way back with directional strategies like mission, vision, values, and goals, and then working through the process, getting to the implementation side, and how that impacts organizations as a whole. So those would be a couple of highlights, Doug, that I would highlight for sure.
Okay, thank you. I don't really have a question. I'm just going to mention something that was brought up last night in part 1, was our career services office and what we can do with not only our students, obviously, but also our alumni of the program. I know, you know, we provide that career support, you know, with the healthcare industry, like you just mentioned, kind of always changing. You know, our career services office is always willing to work with students who are in the program, you know, with job placement, but also our alums. You know, some of our alums who've graduated many years ago have come back and utilized our career services office. So I just wanted to bring that up as something that students should consider, you know, the small personalized attention of a school like Siena Heights. You know, we have career services people who, you know, are willing to be in your corner and work for you, you know, even when you're no longer a student. So that's one of the services we pretty much provide to both our students and our alumni.
Yeah, it's a great point, Doug. I mean, we certainly have that service available to current students as well as alumni. The other thing I'll just reiterate that I mentioned earlier is the importance of networking. The need to network with your local ACHE chapter or whatever the professional healthcare association of leadership is. It could be the Healthcare Financial Management Association, the Medical Group Management Association. There's an association for information systems professionals, so on and so forth. So, I mean, the list just goes on, but the key is, yes, you'll have the degree, you'll have the credential, but who do you know in the industry? And so the networking piece is critical, and I really encourage my students in the program to network as much as possible. Of course, we've been somewhat contained with COVID. all that to say, once this releases itself and we get back out into the general population, I think the opportunities to network will improve again. And I think the more students that I've seen at different ACHE type events, the better off it is for their career, because you don't know how long you're going to be at any one healthcare organization. I think John Labriola, who spoke last night about the bachelor's degree in healthcare management, was at Beaumont for 40 years. I'm not sure that's the norm anymore. I think, leadership today, I think the CEO turnover rate these days is about every 5 years, right? So I think that's what the literature would say. So, you have to be also flexible yourself as a professional to move on, perhaps to a different health system, perhaps to a different part of the country. But again, having those kinds of networks in place and then always being dependent upon Siena Heights and their career services will certainly be a benefit.
Okay. Well, John, I'm going to lean on your expertise here a bit. Obviously the topic of not just the day, but the year so far has been, the coronavirus pandemic. I'm curious to see your observations on how that's changed healthcare. You've had a chance, I'm sure, to watch how things have transpired, and, from your perch and higher ed leadership and healthcare leadership, how that pandemic has affected healthcare.
Well, I guess one of the things I would say is it really shows, to me, it shows the character of the people in the profession. The fact that they will don a mask and all kinds of protective professional equipment every single day to go in and care for patients is just something that, unless you live it day in and day out, it's difficult to appreciate that. So that's certainly one thing, is to realize how dedicated the personnel are. And, I have students that have been in the program during this whole COVID-19 thing and have worked through the process. And so I've heard some stories about how that has taken shape in their particular healthcare organizations. Unfortunately, they haven't been able to stay at home like those of us that are faculty members. They've instead been working day in and day out to care for all of the folks who have been impacted by COVID. With that said, I think the shifts that we're going to see in the industry is related to telehealth. I think we've seen more and more folks shy away from going in to see a primary care physician or a PA or a nurse practitioner face-to-face, and instead transitioning more to a telehealth visit. And so I think we'll see more of that in the days ahead. I'm not quite sure exactly what that will look like in the days ahead, but as the industry continues to live this out, I think they will adapt and be flexible and innovative in the ways that they carry that out in the days ahead. So lots of great things. I mean, I think it really, again, speaks to the character and the integrity of those that have been in the field.
Okay, thank you, John. Well, before we wrap things up, I just want to give people one last call here, last call for questions for John or Betsy. I'm not seeing any so far.
I see, I don't want to put anybody on the spot, but I see that there is an alumni from the program, as well as a current student as an attendee. I don't know if they would be open to sharing any information about how the program has impacted them in their professional careers. And again, I'm not trying to put you on the spot, so if the answer is no, feel free just to stay quiet.
Well, it looks like they're staying quiet tonight, John.
Okay, fair enough.
They're out there. Okay. Okay, well, John and Betsy, I want to thank you for sharing your time with us tonight and your expertise. And I would encourage those who are interested in the program to get started. All you have to do is go to start.sienaheights.edu and fill out a quick form, and we can get get you going on the program. Betsy will be more than happy to follow up, and John as well if you have any questions. They know they have all the answers on our side, so feel free to do that. And again, thank you tonight for everyone who joined us, and check us out next time for our Siena Shares series. Have a good night.
Thank you, everyone.